Major funding for Impact is provided by the ETV Endowment of South Carolina. With the generosity of individuals, corporations, and foundations, the ETV Endowment is committed to telling authentic stories and is proud to sponsor Impact.
Hello.
Hello there.
How are you, sir?
Pretty good this morning.
Good.
You know, when we talk about the silver or the gray tsunami, that wave's been coming for a while. One of the statistics that I've heard recently and read was there are over 11,000 people a day in the United States turning age 65 every single day, and that will continue until the year 2027.
We have 1.2 million older adults right now in South Carolina, and that is growing rapidly. So how do we address that?
Senior Resources are really here to help the elderly in our community, but if you ask somebody who is older, nobody wants to claim the word elderly. Somebody who's elderly is always somebody who's at least 20 years older than you.
I think aging carries such a stigma because nobody really wants to talk about getting older. And then what you see on the media, on the news, what you see in pop culture is, you know, it's almost making fun of the aging process.
Thankfully for many of our older adults, their older years could just be travel and leisure and not so many concerns about health in general. But unfortunately, for some of our folks, the chronic conditions they tend to accumulate have a big impact on their quality of life and their need for proper access to health care of all sorts.
We don't have crystal balls. We don't know what tomorrow holds for any of us. Our hope, no one sets out for retirement and says, you know, what I want to do is go straight into a nursing home. No one has that as their end goal.
I've never been home. I'll never go home. That's the problem with these places. You have no idea how difficult it is to realize you've lost everything and you'll never go home.
You just can't rely 110% on somebody else to take care of your loved one. When your loved one cannot advocate for themselves, it's a different ballgame.
I think that many of us believe that we can remain independent, living alone in our home until we die. And that is the wish of 99% of everybody.
As I tell everyone they should plan for healthcare and plan for what's to come, I personally am not even in a space where I've done it myself.
I'm not well organized enough to have a plan, so I won't pretend that I had any plan except to stay in my own home.
They call it the silver tsunami, the anticipated swell in the senior population as the entire class of baby boomers hit age 65 or older, outnumbering children for the first time ever by the year 2030. It's a national phenomenon, but in South Carolina, with its popularity as a retirement destination, the implications are even greater.
South Carolina is the fourth highest net migration in the United States. And so we have a significant number of people who are moving to the state. Right now, about a third of them are expected to be seniors in the coming years. So that's a huge population that we need to be addressing. And, you know, we don't want to be behind the 8 ball. We're already a little behind, but I think that there's some room to make it up.
So we're headed toward a time that many people call the silver tsunami. It's the aging of America. It's happened to other countries ahead of us, so we've had some examples. We've had things we could watch to see how that works. As a society, we haven't paid much attention to that. We've continued to really kind of devalue aging and aging people. We fought against it. We don't like to talk about it. As a nation, we're headed there, and there's going to be a massive number of people, and the curve really just now steepens and keeps going for a good long while before it flattens out.
With the change in the population demographics comes the need to reevaluate and address the opportunities and the options available to serve our seniors, and to meet the myriad challenges the process of aging may demand. Key among these are issues of housing, healthcare, finances, legal protections, safety, accessibility, and social isolation. Issues that often overlap, creating and compounding a network of concerns that challenge the goals of positive elder living.
Our mission and our goal is every day we come to work here to ensure that our older adults in South Carolina have those services that are available to them. In the state of South Carolina, there are 10 area agencies on aging that provide services to our older adults.
With so many people turning 65 and the significant amount of people aging every day, what we're going to have is that baby boomer generation moves into the senior category, needing all senior services that current seniors need. We are very likely to have workforce help issues regarding independent living, retirement communities, end-of-life planning with hospice workers. I worry about the number of hospital beds. All of those problems are only going to be multiplied times 2 or 3 in every area.
I think one of the biggest issues facing our older adults in South Carolina right now is the issue with housing. And we also know that there's not enough housing for these individuals. And when I say not enough housing, I mean affordable housing.
Planning for retirement is something most want to do. But when you're living paycheck to paycheck, and oftentimes there's more month than there is money, you're forced to make difficult decisions.
So if I had to think about what I would be concerned about most if I was a senior today heading into retirement, it would be having enough liquidity or enough cash. Because cash, if you have enough, you don't have to spend it down.
Now, there are options for those above middle income for private pay. Nursing homes, we call them CCRCs, Continual Care Retirement Communities. So nothing's wrong with my health. I'm 65 years old, but I don't need the big house anymore. I'm gonna move into a continual care retirement community, and I'm gonna have a cottage. Still gonna have my independence. I can tap into any of the resources that the community offers, like dining services, social services that allow me to meet other seniors. And as my care increases, I can then move from my independent cottage to assisted living, and then on to full-scale nursing home when the health care needs increase and get to that point. If I can write a check for oftentimes $7,000 to $11,000 a month and self-pay for that, or more in many communities, as you know, then we're okay. But that's not where most South Carolinians are.
When I think about the challenges for seniors today, one is lack of preparedness for retirement when it comes to income. We see that a lot of baby boomers in reports have less than $250,000 to last them throughout retirement, and that's fairly inadequate. And then the next thing we tend to see is there's a fair amount of debt that the baby boomers carry into retirement. When we think about it, I think it's about 65% of baby boomers carry mortgage debt, credit card debt, and the like into retirement, and that can become a challenge.
The CCRCs have done a good job of taking care of people who have enough means to pay for that. Medicaid's catching people here at this level, and affordable housing is catching them. subsidized housing, the HUD stuff that we've known about for the last 50 years. But what about these folks in the middle? They don't have enough resource to go here. They have too much resource to get helped here. What do they do? Because right now what we see them doing is they stay home and fend for themselves as best they can. So we've set our sights on, can we design something that can carry itself? We're pretty much there, and we do have a program and a plan that will work. It's 182 units total for that campus, and we will build them all in one phase. That's what helps it work. A place where middle market people can come get all the same benefits of living in community together that anybody else can get, even if they have more resource. That's the goal. That's the plan.
Independent living, assisted living, and long-term care are the three basic options. Each senior's experience will be different.
I was very active. I could never really walk again. I was in my wheelchair. I could use the rollator, but I lived by myself. And I lived like 20-some miles from, anywhere pretty much. So I thought it was smart. And I got one of the tags, the things you press, trying to be halfway self-sufficient. But I had a massive stroke. I don't know what happened, other than I ended up on the floor. I was in ICU for a long time, but they never really bothered to turn me or pull me up. I developed bed sores on both legs, both feet, because I almost lost my feet, and on my hip. All those bed sores came with me when I came here. It was a very slow recuperation. I have some very good nurses. My day nurse was awesome. It still is awesome. I can't get out of bed, and there was 5-6 months that nobody would help me get out of bed, and I'm paying for it. I'm gonna die here. I don't like it, and there's not much I can do about it, but I'm in a lot better shape than some of these people here. At least I can speak up, and I try to speak for other people.
Although not yet a senior, Tripp Rhodes has already confronted one hurdle: choosing nursing home care and the right long-term care facility.
I got hurt in 2010. I fell off my porch. I fell 3.5 feet and just kind of cracked my neck and broke my C5. It put me in the Shepherd Center for, 6 months or so. And then I went home. My mom took care of me, and then interviewed here, and then came and sat with my roommate. And now I've been here 8 years, and I've loved every minute.
Just because the outside looks beautiful or just because the inside looks beautiful doesn't mean that the care is going to be good. And so we really encourage families and individuals who are looking to move into places to visit at different times and to really investigate on their own the type of care that is being received in the facility and in the residence before you make these decisions.
So I'm 50. So you back it up 8 years ago, and that's when I moved in. And the coming in with other people my age and the lively group where I was depressed at home, it brought a depression out of me and got me in, to going around helping residents if they needed help. It's a very good place.
We still provide the medical care, but we want it to have a home-like experience. Our residents don't live on annexes or they don't live on halls. They live in neighborhoods. So therefore, it does have a more home-like environment.
Staffing shortages are evident throughout the healthcare industry. Low pay, poor working conditions, and lack of training are major deterrents for those who serve the elderly.
My training and background is geriatrics, which is care of older adults. The number of physicians entering that profession is substantially lower than the numbers of physicians retiring or leaving the profession. So we're going to have a bigger gap in terms of doctors trained in the specifics of older adult care.
In many of your facilities, the people who provide the care have multiple jobs because of the pay structure. And this is just not a South Carolina issue, it's a national issue that the people who provide the care, they are paid slightly above minimum wage to provide the level of care that they provide on a daily basis.
They hired a bunch, but they don't stay. And I just figured it was because they're not paying them enough. That's a problem in this industry.
There's a lot of turnover in these caretaking places. You know, some people have worked there for years, and other people are just kind of coming in and testing the waters, and then they leave.
You got to create an atmosphere where people want to come, they want to stay, and they're getting paid decently to where they can afford to stay.
Of course, we believe that there should be quality of staff, but there's a numbers problem. We have to have the people that in South Carolina that can actually fill those jobs. And we just have so many job openings currently within the medical field.
And so everybody's looking for that same CNA or certified nursing assistant or just that general caregiver who can provide that care. So we're running into a problem of beds and caregivers in the facilities and in the community.
Negative stereotypes plague many nursing homes due to preconceived notions of abuse and neglect.
We investigate abuse, neglect, and exploitation in long-term care facilities. We are one of the few individuals that go and visit long-term care facilities on a regular basis. Sometimes in facilities things are really good and residents are getting all the care that they need and things are wonderful. But there are some times when we go to facilities and things are not so good.
But I always have the fear that the most vulnerable people have the roughest time. My brother was in one that got closed down.
The first time I was in a facility, not this one, but a former facility. And that's where I saw some pretty rough things. I had a roommate there that passed from neglect, put her in a wheelchair at 10 in the morning and didn't take her out till 10 at night.
That's part of my job, is to advocate for these individuals and let individuals in the community know that, you know, this is an issue and people should be aware of these kinds of problems.
But there's also a segment of the population who believes in keeping mama at home for her Social Security and her pension and not taking care of her. Now that's an affirmative act of abuse and neglect. And you can also have self-abuse and neglect. In many cases where I meet with family members who are concerned about their aging parent, it is a situation where they're actually causing abuse or neglect to themselves by failure to accept help.
I think we have to really start changing the narrative of aging. If we are constantly saying, oh, this is a bad nursing home, or avoiding those conversations, how many people want to go into a field and work at somewhere that is constantly getting bad publicity or bad PR? Are there bad players? Yes. But is that the exception and not the rule? Also, yes.
With a vibrant network of family and friends, retired Clemson University professors, Drs. Bhuvanesh and Dixie Goswami, continue to value their independent lifestyle.
I live in a house where, far from isolation, There always people coming in and out of Strawberry Lane. I've always got a young person who's living here because they're homeless or because we want them to or for whatever reason. That helps.
She is a wonderful person. I have never seen anybody who is so active even at this age. She gets up even before me in the morning. She already has made her breakfast, and by the time I come down, she is ready to tell me what is it that we need to do during the day.
In 1968, Goswami, a bachelor, married Dixie Gooch, a young widow with 6 kids who was 6 years his senior.
I came here, I was a bachelor at that time, I was 30 years old, and she was teaching at Clemson and I was teaching at Clemson, and we were invited to a party. I saw that she was one of the greatest minds she had. The stories that she told me, and at the same time the activities in the department, and I think that attracted me to her. She's a beautiful person inside and out, and I think I admired what she had gone through and she was going through with a smile on her face.
Everybody is going to suffer losses. One way to find joy in living in spite of that is to take great joy in small things that you experience that are positive.
She never complained. That was one thing, that really attracted me to her.
He seemed to be one of those wild and crazy Indians. He was dancing. I've never seen him dance since then. I can't imagine what in the world why he asked me to marry him. But anyway, he did, and I jumped at the chance.
We both of us have been very active. I had been traveling up until the COVID came, even after I retired. When I retired in 2005, 2006, up until then I was traveling all over the world. Dixie, in the meantime, has been very active with her children, even though she had a bad fall and she broke her neck in November of 2010. And she went to teach in the summer of 2011. And it was remarkable to see her determination and her dedication to teaching and to her students.
I would like to say that you don't get necessarily any wiser as you get older. One of the things that keeps me going is I keep learning. I'm so lucky to be working and in touch with young people. I co-direct a network of young people from 6 states. We are just now beginning to meet in person again, and they're going to have to come here to meet me the next time we get together. But we meet on Zooms in any other way we can. I'll never make a conscious choice of going into assisted living. I've seen the good and the bad and the ugly, and some of them are wonderful with dedicated programs and people. And I know that if I didn't have a family network, I couldn't make those bold statements.
We don't think we are at a stage that we want to move to assisted homes or assisted places.
Strawberry Lane is like Grand Central Station. I got neighbors I've had for 50 years across the street, and I got their grandchildren there now. It ain't a bad place to be. I mean, how are you going to feel bad when you got a little great-granddaughter who loves you and makes you laugh, comes to see you? My God. We're black, we're white, we're brown. We're from the Philippines, we're from India, we're from all over the damn place. And I am from rural South Carolina. That's my home. I still have a home that I can call home.
Studies have shown how necessary social connection is to well-being. There are studies recently that showed being lonely and socially isolated is as dangerous to your health as smoking 14 cigarettes a day. And so what we try to do is, for those seniors who are able to get out, that they have that social connection And that's where programs like an exercise class at a local senior center or just a lunch program to come together and share meals, meet new friends, have someone to check in on you are super important. And that even applies to our Meals on Wheels program for those homebound seniors. Often the only person they see in a given day is the person who's delivered the meal. And so that's their only human interaction for the day. And it's that social connection that's oftentimes just as important to their health as the meal that's being served that day.
Here at Mountain View, we're constantly help them battle loneliness, helplessness, and boredom, which is really the main problem with people who have to live in an institutional setting. It's the separation from family, separation from friends. So we as staff try to fill that void by giving residents a meaningful opportunity each day to participate in activities, engage in discussions with each other, as well as staff.
Mom was staying, she and my father lived on the coast. And so I had found an assisted living for her on the coast, sort of near my family members, hoping that they could come and visit, you know, a little more often. And her friends could come visit. She had some friends down in that area. But the reality is that when you go into assisted living, you know, people just don't come to you as much as if you were out and about seeing people.
Isolation is a huge issue in senior care and elder care in general. We saw that during COVID. We see the after effects of that now, but it has always been a part, I think, of senior care in general. Unfortunately, there are times when, especially now in South Carolina, we have a lot of folks that are moving here, and they're moving here to be a part of their grandchildren's lives. And we welcome them, and they get here and their children are working and their grandchildren are off doing their own thing. And so they get here and they're removed from their social circle and they're in a different community, and maybe their family isn't around as much as they initially thought they would be. And so they're very isolated from their support network. And perhaps then they have a fall or something and they've moved into a long-term care facility, and then they become even more isolated. There are those things that happen and people become depressed. They don't want to really and truly continue with living or making healthy decisions and things like that. So isolation is a very rampant problem with our seniors. There are many times that, you know, people will say, well, I'll come see you in the facility, or I'll come visit you, Grandma. And unfortunately, maybe those visits start when they first move in, but they become fewer and far between.
Caregiving is a very, very multifaceted role, and people do it out of love. They do it because they care for the person they're doing this for.
Being a caregiver means that you are responsible for another human's life. I'm a single woman and I don't have children, but I do have a 92-year-old mother getting ready to go on 93.
I think that definitely is a struggle when you become the caregiver. It's first recognizing that that's actually who you are, and also understanding it becomes a full-time job. So when you look at the different options available to you, sometimes they look a little more appealing than they did before.
Caregiving in general is extremely stressful. It takes a lot out of caregivers, and what we've seen in some studies is that caregivers sometimes get even more sick than the individuals that they're caring for because of the mental load, the physical load, everything that they have to deal with. So it's a very important topic, and there's a big need for us to support our caregivers.
So, you know, finding myself as a caretaker, you know, I don't have her in the home because there's no way that I could do that, in all honesty, and keep a job. And I'm very lucky to be able to have placed her into an assisted living to begin with after my father died, and then now she's in dementia care because she's getting older. Luckily, we had saved up some money for that, but it is not cheap.
Being in the industry and working with healthcare, it's interesting because I can tell everyone else what they should do, how to do it, what the resources are. But when you get to a point when it's very personal, things slightly shift. So now I'm in a place where I'm maintaining my parents in their home and making sure that they're safe, allowing them to have their independence as long as possible. And that's important for personally and of course professionally with our clientele. We want people to remain independent as long as possible. But of course things happen. So we're looking at the different options for the what ifs. What if this happens? What if my father can no longer be a care provider? What if my mother progressively gets to a point where she can't care for herself? What am I to do as an individual who's still working, who still has a family, and trying to be able to give her the care that she needs?
It's difficult when you're working with a facility because you do think when you first get in there that, oh, everything's taken care of and I can just come by, you know, maybe once a week, maybe less than that if I'm busy and they're taken care of. But I will tell you that things fall through the cracks.
Family members as caregivers are so vital only because those individuals are there day to day. They know the habits of that individual. They can kind of give you a brief overview, even when sending a private caregiver in, what that person's day looks like. But being a home care professional, understanding that we are necessary to give that individual a break.
There are approximately 219,000 caregivers in South Carolina. It is estimated that family and other significant others render some 361 million hours of unpaid care, with a total value of $5.55 billion.
Well, for me, being a long-term care ombudsman is the best job in our agency. We have the job of advocating, educating, and just being sure that their rights are being honored and people treating folk who live in these facilities with dignity and respect.
I ended up losing my house and was foreclosed and I couldn't do it, but there was a little bit of money that came through and they weren't going to give any of it to me for 12 or 13 months, and my advocate, my ombudsman, stepped in and had a big discussion with them.
So if you need long-term care in a nursing home and you qualify for Medicaid, then they take your income and all but $30 and apply it towards your care. So if you have an income of $2,000 a month, they will take all but $30 of that and apply it towards your care, and Medicaid will pay the rest.
We was getting $30 a month, and you buy, a pair of pants or something. You had to wait till the next month to get, anything else. And if you wanted to eat out and have it delivered, that one meal could cost you, and then you had to wait till the next month to get the next meal,
Effective October 1st, 2025, the personal needs allowance doubled from $30 per month to $60 per month. This marked the first increase since 1987.
In South Carolina, it's estimated from the Alzheimer's Disease Registry, which is housed run by the University of South Carolina, that 11% of the population over the age of 65 is living with a diagnosis of dementia.
Dementia in itself is a disease that affects so many people. You're not going to find anybody that doesn't know about dementia or doesn't have a family member or a loved one with dementia.
We are one of 4 population-based registries in the United States. We focus on Alzheimer's disease and related dementias. We are the oldest of the four, and we are the most comprehensive. With our most current year of data, we know that there's over 125,000 individuals living with the disease in the state.
We've got more South Carolinians living with a dementia diagnosis than would fit in Williams-Brice.
What we have seen is in the PD region of the state, we see the highest number of cases there. And then also in the upstate, we see cases that are more related to vascular dementia, and the PD region is more Alzheimer's dementia. Along the I-95 corridor on the eastern part of the state, we see a large number of cases there. If someone has a higher risk of stroke, more cardiovascular disease, they may have diabetes, or other certain comorbidities that are that they have lived with for a long period of time, that does predispose them to developing Alzheimer's or related dementias.
Orangeburg County is number 8 in the entire country for the prevalence of Alzheimer's disease. We're talking about behind Miami and the Bronx. Those are staggering statistics, and we need to be prepared within our communities to be able to have the resources, the financial resources, our programs, to be able to have a safety net for people as they age.
And I would say in the population of people that I deal with, which is 80 plus, that has really become a bit of an epidemic.
Age is a leading risk factor for Alzheimer's, but Alzheimer's is not a normal part of aging.
On a state level, one of the greatest things about the Alzheimer's disease and related dementias task force is that it's bringing all of these groups that have typically been siloed, it's bringing all of those stakeholders to the table. And that's a really important piece that South Carolina is actively working on.
I'm part of a national association called Leading Age National. Leading Age National is, all it does is represents not-for-profit senior living of all types, whether it's affordable housing, assisted living, skilled nursing, continuing care retirement communities like where we are today. They represent all of those, and they have been beating the drum for as long as my career has lasted about this age wave coming. What our Congress and Senate has done about that is that they've kicked the can and kicked the can and kicked the can, and they've never dealt with what's coming. So now we see a Social Security system that is not sustainable, a Medicare system that's not sustainable, a Medicaid system that is not sustainable, in fact, has just gotten cut severely. We act like this is brand new information that we're just now being faced with.
It takes a constant process of reminding them, don't forget the seniors and the impact of what a budget conversation may be. And so every year, every budget cycle is a mixed bag. Some years we make some progress in one area, but recede in the other.
In a lot of studies that about 1/3 of baby boomers use 90% of their income come from one source. So, and that's Social Security. And that's really become a big, big challenge. And then the other thing I think that really resonates is the cost of healthcare. So healthcare continues to rise, and we don't see that, kind of alleviating anytime soon.
I think that it's disingenuous for anyone to think that people who are aging and people who are disabled can financially take personal responsibility for their health care. You can't get health insurance that is affordable if you have no money. You can't get Medicaid unless you have no money.
In order to even get to a nursing home, right, with Medicaid, the assets have to be out of your account 5 years prior. So you can't say that, yeah, I think I want to qualify and go to a Medicaid facility or a nursing home. You can't do it if you've got assets over a certain amount.
Mountain View participated in the Medicaid program, and to this day, Medicaid sponsorship is our focus. Medicaid recipients receive priority for admission to Mountain View.
Sadly, Mountain View is one of 8 South Carolina nursing homes at risk of closure due to the federal budget bill.
With the recent new budget that takes money away from the Medicaid program and continues to do that for the foreseeable future, and all the other changes that are coming, really is going to be detrimental to the average American in the aging process.
The biggest challenge to aging is you just don't know what's next. You don't know when your health is going to have a challenge. You don't know when your family or friend circle changes. Somebody moves away or passes away, and somebody who was there for you your whole life isn't there anymore. You just don't know. And so the way to combat that is to think ahead and to be ready and have plans in place. How can you live independently when your health declines? Don't wait for your health to decline to start that planning. Start doing that earlier.
And I think the more that we can educate everyone about what is aging and what sometimes services you need when you're aging is really important. But I think the beauty of aging is the fact that you can take all of your life's experiences and you can determine what's going to be next. Life does not end when you retire. Life does not end when you're 70, when you're 80, when you're 90.
I was just home and I said, I can't sit in this house. I need something to do. I've always been active all my days working. And so everybody said, why don't you come home and sit down? I said, no, I got to keep moving. And I just enjoy working and being out with people. I like to connect people and see how people act in their old age. So after I got this program, they said, well, don't you think you qualify for the program? I said, I am, but I'm the site manager of it. This is a program for seniors. It's funded through the Appalachian Council on Government, and Meals on Wheels have the grant for the next 5 years to administer the program. And I am the site manager. Our first program started in 2019, April 2019. Age range, we have to be 65 and older, and 65 to 99 years old. We have one person turn 99 in July of this year. We have several people in their 90s, and they can't wait to get here. And most of them still able to drive themselves to and from the center.
After coming a couple times, I found, I like the interaction with the seniors. I seen what an advantage the program was. Just people getting out the house, the older seniors, and how much they would enjoy it. And it finally grew in me, and I was enjoying just coming, getting up in the morning, having some place to go. And we started just spending some time together. And I realized that something was special about this lady. About a year later, at one of our meetings, we had talked about it. I said, I'm going to ask you to marry me. Let's see what you say. And in March 15, we got married.
I look at aging as it's a gift. It's how you treat yourself from an early age up. Exercising, eating, having a positive outlook on life. We should speak life rather than death. And that's the way I do now. I speak life in every situation, regardless to our moans, groans. We should not let it take the advantage of us. Just enjoy life every day. You wake up every morning, and it's a blessing to see a new day.
Good evening and welcome to Palmetto Perspectives, Parenting Our Parents. I'm Darcy Strickland in for Thelisha Eaddy. Once an adult, twice a child. It's an age-old quote that reminds us that at some point in our lives, we will all need some help. As children, we rely on our parents to help and protect us, but as our parents get older, it becomes our job to help and protect them. This change is often challenging and can put a lot of stress on families. So how do we adjust to this new chapter, and when do we start the conversation with our loved ones? We have invited a very distinguished group to help us navigate these conversations. Joel Lurie is a familiar name. He is a former member of the South Carolina House of Representatives and state senator, and he's also the founder of Lurie Life and Health. Tanya Rodriguez-Hodges is the founder and president of Limitless Community Development, a South Carolina-based nonprofit. Dr. Macy P. Smith is a licensed gerontology social worker with more than 20 years of experience working with aging and vulnerable populations. And Connie Munn is the director for the South Carolina Department of Aging. Throughout this show, you will see a graphic with the website and phone number for the Department of Aging. If you need assistance, you can call 1-800-868-9095 or go to getcaresSC.com. Again, thank you so much for joining us, and we're going to get this conversation started. Director Munn, we'll start with you because you know firsthand how this can be a very difficult conversation to have for families with their loved ones. When do we know that it's the right time to start having that talk?
Well, you know, unfortunately, we don't have a notebook that gives us that guideline. It's so important to really just know where your parents are in that stage of life to know how to start the conversation. Sometimes it may be earlier on, and sometimes, unfortunately, our older adults, you know, and our parents don't really want to have that conversation. So it may take just beginning the conversations and working up to those difficult conversations. As you said in the introduction, it is extremely hard to have those conversations with our parents. And many times they are not responsive, or they don't want to hear it because they raised you and they don't want you to have to take care of them. So you really just have to know your parent, understand the situation, understand their circumstances before you start having that conversation with them. But when you start seeing the decline, or you see that they may be going down that path to where they might need to be placed in a nursing home, it's so important. We see so many times that sometimes it's too late. We've waited to have that conversation. So just being intentional and being there and present and knowing when they're okay with having that conversation.
Dr. Smith, you have done this for more than 2 decades. You've helped families find the right language to have the conversation. I would imagine that there's never a time that's too early to start talking about it.
Absolutely not. I think there's a misconception about who's aging. Mm-hmm. Every day we're all aging. The decisions you make today will determine how you will be tomorrow. Will you be independent? Will you be living on your own? So the time to start having a conversation is now. It will shift in terms of if you're planning for yourself. I have one daughter I have been planning for some time. She goes with me to these training events because I want her to be prepared and ready. But when it comes to your parents, because you know they don't want to get old and they don't want to seem like they're old, I think it's best to have smaller bite-sized conversations, not talk about, okay, when you die, where are you going to be buried? But just start talking about, in the event you become ill or injured or have an accident, who do you want to make the decision? And the family caregiver should have a notebook and start writing the information down. And then the next time you have a conversation at dinner or at breakfast, then go to the next stage. So don't have the whole gamut of the conversation all at once. It's very overwhelming.
Tanya, I think it's difficult, and you can speak to this personally, when it happens quickly, you know, when there's one moment where our parents are completely independent and living their best lives, and then the next moment you have become their primary caretaker.
I think that I was born, though, to be their caregiver. I grew up in a time where remote controls were non-existent, and my parents, as I was growing up in my formidable years, I remember the conversations about sodium and cholesterol. So we had a plan in place. I just didn't realize how quickly, you know, death by 1,000 cuts, dementia would be, and from one moment to the next, how quickly we went from a physical appointment at the doctor's office to, I cannot believe how quickly this is going, and it did seem very much like it happened overnight.
What advice would you have for a family who is dealing with that today?
Ask for help. I think that we are trained, especially ladies, that we are to just absorb and take in as much as we can because we're strong. If I had just asked for help when help was being offered, I think that I would not have had the mental breakdown and the physical breakdown that I did once both parents took their better offer and went on to a heavenly place.
Joel, a lot of times we think that there are so many things we need to handle on our own. And I think people still look at you as a lawmaker, even though you took that hat off a long time ago. But where does the government step in times like this?
That's a great question. And just watching the incredible presentation before, and big shout out to our friends at ETV for taking this issue on, by the way. I just think the documentary was excellent, and looking forward to this presentation. I think the government really, and I'm going to use South Carolina, you know, my dad served for 28 years, I served for 18 years, and he and I were both strong advocates for our aging population. But I think the government probably is a little too reactive and not proactive. And I think if you look at perhaps the healthcare infrastructure in South Carolina, and Director Munn, you could probably speak to this too, everybody could. In terms of when you look at the demographics of the people that are coming to South Carolina, and we have an office in Myrtle Beach. I bet 19 out of 20 of those people haven't been in Horry County, haven't lived there for more than 5 years. Okay? Wow. It's amazing. If you moved away and come back to Myrtle Beach, you wouldn't recognize it. But we have got to make sure that we have enough healthcare providers. You know, very few people coming out of residency want to get into primary care medicine or internal medicine because they have so much debt. They want to go into a specialty or to become a surgeon of some sort where they can generate a higher income. And then we don't have enough residency program. And then you go into the nurses, the radiologists, the people that do the techs, that do the lab work and that kind of stuff. We're falling way short of that. So as our population shifts, and if you go back and look at the last 15 years, we've gone from about 22 to about 33% of our population 55 and older. Where our population has grown significantly, this tsunami is real. And I think the government has to be better prepared to make sure, because let's face it, very hard to afford a long-term care policy today. There aren't just Medicaid beds popping up everywhere for people that fall into into Medicaid and are eligible. So we've got to be prepared to make sure we have enough a medical infrastructure that can deal with this aging population. And I think we could be a little too reactive, and there are things we need to be doing now, because the next 10 to 20 to 30 years are going to really be potentially catastrophic if we're not prepared.
And preparation is what you do, Director Munn. I think there are people who may be watching this evening who may not have even heard of the Department of Aging before tonight. Talk to us about what your agency does and how you all are trying to get in front of the silver tsunami.
Well, so we basically, our mission and our vision is that older adults can remain in their home, healthy, active, living at home with the services they need. And part of that is making sure that we have those services in place. But we also know a big issue with the workforce. And so we do know, we saw it in the video, in the documentary, there's not enough in our nursing homes for home care, which is where, 99% of our older adults want to remain at home, but there's not enough services, there's not enough workers to be able to provide those services. But part of what we do, and I think it's so important because we're talking so much about caregivers, is we were able to go before our legislators. We showed the impact for our caregivers, knowing that we did not have the resources in the communities. And so they funded the positions for us. They funded 10 positions. They're all in our regions. This was just funded this past year. And so we're really excited about that because it was at least the legislators were understanding that impact. And we know that if you are a caregiver, you're going to be one day, you know someone is in your church, we have to take care of our caregivers. And so having those dementia care specialists out in the community is key. Also, like I said, the other services that we have to contract with all of our area agencies on aging. There are 10 of them across the state, and those are the ones who they are the boots on the ground, if you will. They contract with our providers to provide the services. But we think what's so important is making sure that our older adults know the resources that are available. And so you don't know what you don't know. And so we have to be able to have that information. We've updated our website. We have Get Care SC. That is a website, a state-of-the-art database that someone can put there. If you're looking to move to South Carolina, you can just type in your zip code and it takes you to all sorts of resources that are available. It has the bed locator, but also it has that option that, because many times people don't want to put something on a website, they want to talk to somebody, and we have that option as well if you type that in.
Well, the great thing is that's a wonderful transition into me giving this phone number again. It's 1-800-868-9095. Obviously, there's nobody there to answer the phone right now, but they'll be available first thing tomorrow morning to have the conversation about what next steps could be in your planning process. As we learned in our documentary, in 2030, there will be more people over the age of 65 than ever before. And statistically, this has not happened before. Is our healthcare system, Mr. Lurie, prepared to handle something like this?
Yeah, and by the way, I think Director Munn and the Department of Aging do an excellent job, and just was always really proud to support them. I think we've got a lot of work to do. I mean, I'll look at, for example, the partnership that this past year, or it was announced 2 or 3 years ago, that Lexington Medical Center did with the University of South Carolina to create more nurse education slots available in a joint venture. And I think that kind of innovation and creativity is what we need, because I'm worried about the system. I mean, our company, we work with seniors and helping them decide what makes sense from a Medicare standpoint. And we can spend all the time in the world making sure that certain doctors are in the network for the plan they choose. The challenge is going to be having enough doctors. The challenge is going to be having enough beds. And I think we're a little bit behind the 8 ball, and maybe we need to invest more in innovative partnerships like we saw with Lexington University of South Carolina, because that's where the need is. Not only for the nurses, but the people, the lab techs, the nursing assistants, trying to figure out an innovative way to recruit more primary care physicians or internists, because let's face it, everybody says it's coming, it's pretty much here, and all of us are going to be part of it one day.
And that's a good point. All of us, if we're lucky, like my granny used to say, will get old. And so aging doesn't have to be a negative thing. How do we have the conversation, Dr. Smith, where we change the narrative and we use the positive language about getting older?
Well, I think a lot of times people who talk about people getting older are actually older themselves. They don't see it, and that's okay. Age definitely is a number. You are how you feel, but as I stated earlier, you're aging every day, and so you have to plan for long-term care, just like you plan for your children's college funds. To Joel's point, I don't even know if long-term care insurance even exists today. If it does, it is unaffordable. But this is the language that people typically don't know. They think when they turn to age 65, they get Medicare, and Medicare covers the gamut of healthcare, but it doesn't cover long-term services and support. So non-medical care, someone coming into the home to provide support with ADLs or IADLs. It doesn't pay for assisted living. And so part of the problem with the narrative of aging is what we see on TV. Reverse the aging process. I don't want to reverse the aging process because that means I'm not living, right? And we have to continue to see different elements of what aging looks like today. Because I promise you, aging today, someone 80 today does not look like the person 80, 50 years ago. And so really telling your age, because more so women than men, don't tell their real age. Tell it, because you look good. When you look good, you feel good, you do good, and you motivate and empower other people. So I think it really does start with us in sharing our true story and sharing who we truly are, because again, what you choose to do today will determine how you will be tomorrow. I can't say that enough.
Yeah. I think so many of us imagine that old is 5 years older than whatever we are at that point, you know. Maybe 10 years for some people. But there is beauty in the aging process. And Tanya, there's even beauty in the ability to be able to care for our parents.
Absolutely.
In that as well.
I consider myself fortunate through the good, the bad, the ugly, and diaper changes, that it was an honor and a privilege to be there for both my parents and to have that experience of being there when they took their last breath. For me, for my children, and for my beloved husband, who no matter the time or day would do whatever he needed to do to support, you know, his in-laws. This is a full circle moment for me, because we have senior resources here. They helped. We have aging. They helped. Macy was the first person that heard me, saw me, and was able to speak to my panic and what is happening. Yesterday she knew what a spoon was. Today she does not know what a spoon is. And Macy helped me just kind of organize everything. And then from there, it was so much easier. And every time I called Macy, and there were many a time, at 3 in the morning or 3 in the afternoon, to say, I don't think I'm gonna make it. This is harder than I thought. Because my mother was 86, my father was in his 90s. She had words, and her words were constant. They were constant and the same. It's not about you, it's about her, it's about them, and make certain that you're listening to whatever that fear is in this moment. So in the beauty of that is that age-old thing of you are here to take care of your parents, no matter how you grew up. I'm an advocate for that, because my mom had some issues. We had some issues growing up, and she apologized for those. But in spite of that, it was my privilege and my honor to take care of them.
And you know, I understand that intimately. Yes. I had the privilege and honor of caring for my mother in her final days, and Macy was always there for us as well. Yes. So if God ever put an angel on this earth, Dr. Macy P. Smith was there.
Amen.
Let's just turn this into a Macy. I can't tell you the number of times I've called Macy for clients of ours.
Yeah.
Okay, for clients of ours. But Darcy, I want to tell a quick story. A lot of people don't know. So I lost my father at a very early age. You know, he was the real Senator Lurie. He was the real one. And he died of a very progressive disease called progressive supranuclear palsy, PSP. Yeah. Think of it as Parkinson's on steroids. He didn't make it to his 71st birthday, okay? And to Tanya's point, we would encourage my mother when she would accept this invitation to go to the beach for a couple days with friends. And my brother, who lives in Columbia, is an attorney, and I would take the time, you know, we take turns spending the night with Dad while she was out of town. And finally, she just was not comfortable leaving anymore. But I've seen it on both sides. I mean, it was a blessing. I remember my dad calling me one day, because he was up all night, and he knew I had to go to the State House the next day. And he called and said, son, I'm very sorry that I kept you up all night, because he would get up. It's a terrible disease. And I said, Dad, to your point, I said, look, you took care of us when we were babies. It's my honor to take care of you, but just promise me you'll do the same thing to my brother tonight when he spends the night. But I've seen it on the other side. My mother's 85. She just took off today on a trip to the Dominican Republic.
I love it. I love
For
it.
a family wedding. I called her last Friday. I called her every morning on my way to work, and I said, Mom, what you doing today? Honest to God, she says, well, I'm not going to go play bridge today because the carpet cleaner's coming at 11. I'm having lunch with Jane at 12. Then I'm going to a workout and dinner, and then we're going to the ballet. So I'm not going to play bridge. That's more than I do in a whole week. So, you know, you see it on both sides. To Macy's point, we all age differently. Yeah, we really do.
But we have to start planning today for that.
Sure.
How do families know that it's no longer safe for mom or dad to stay home alone?
Well, I think they have to pay attention. You know, a lot of times it could be, and just from a personal experience, we had, you know, my father-in-law had dementia, and we, for a couple of years, I kept saying to them, I don't think he needs to be driving, but the family did not want to admit it. But one day, he didn't come back home, and he was in the car driving. Well, that was the worst 4 hours of our life. And so, fortunately, he was able to get to a filling station, and the guy called, and we were able to go get him. And so I constantly tell people to pay attention to those signs, because when they start forgetting, if they're out driving and they forget, many times family members are like, well, we just hate to take that independence from them. But what would happen if they don't ever come back, or in their wreck, or they injure somebody else in a car accident? So just always making sure that you're paying attention to those signs,
And
because
I guess
they will tell you.
They will tell you, and we probably should stop looking at it as taking something away from them. Instead, we're giving them the power to live longer. We have a live studio audience, and we've got our first question this evening from Jennifer.
So my question, Dr. Smith, what would be the best time to talk to a family member if you live away from other people and the one you care for is in another state? So a long distance caregiver, if you will, and maybe they come in and they see things that the caregiver who's there all the time has not noticed. So how, if you are that long distance caregiver and you're coming into the home with the family that's there all the time, what's a good way to approach that subject?
Yeah, that's an excellent question. It's important to speak with, before you speak to the senior, because the last thing they want to lose is their mind, right? So you need to come with facts and receipts. Talk to those around the person, just to ensure that what you're seeing and what you're thinking is actually happening. And that person that's there all the time, because they're there all the time and they're inundated with care, they may not even notice it. And so speaking to the neighbors, speaking to other family members that may come over and visit, friends, and just talk about what they've seen, what your concerns are, and compare notes. And then from there, I am a proponent of least restrictive environment. So I don't automatically make recommendations to the family and say assisted living or nursing home, because there are so many factors to consider. I always start with in-home care. People really underestimate the power and the relevance and the importance of in-home care. They're not just there to provide hands-on care. They're there for companionship. They're there for transportation measures. In fact, the caregiver, the paid caregiver that comes in, they can get more out of that person and get them to do more than any family member does, because again, you're the daughter, that's your role. You're not my nurse, you're not my manager, you're not my boss, but the caregiver comes in, Miss Lucy, and just say, all right, Miss Janie, you know, you need to get up and do some stuff today, come hang out with me today, because that's their friend. And so it's important, don't go to the senior first with your concerns, because it may be a reasonable explanation as to what they're seeing, but really have the conversation with the family. And when I say family, that's family by choice, biological, or family by chance. Those are the family members and the people you've developed a relationship with at work, in the community, at the grocery store, at the pharmacy. You know, they can play a role as well. So really talk with those natural supports first.
Great question. How do we prepare our parents financially for in-home care?
Oh, that's a good question. I might toss that to Joel, to be honest with you, because again, the lack of knowledge, thinking Medicare is going to fund it, and so you miss the boat. And so I think we're having a conversation now that we should have had 50 years ago and had it be a part of the natural conversation. But I do know one thing I do recommend, and I'll toss it to Joel, is life insurance. So whole life insurance, depending on which one you have, look at a long-term care rider to see what that looks like. I mean, it's never too late to do that, but again, the cost of care, you're gonna have to, consider it as a reasonable expense in your planning.
I'll pick up on where she left, and she's actually right. We're in the middle of Medicare enrollment. I can't tell you the number of times that people call the office right now wanted to know what type of long-term care or home health care benefit they have with Medicare, and they don't have any. I mean, it doesn't cover custodial type care. It may cover transitional care if somebody's moving from a skilled nursing facility back into their home after going through some sort of rehabilitation. And so Dr. Smith is 100% right. Now is the time where people need to be looking at either saving money in a separate account to pay for that nurse or home health care worker to come into the home. There are certain types of insurance plans, they're called like home health care, short-term health care plans, that will help pay for some of that too. Long-term care, unless you are extremely wealthy, is almost cost prohibitive. I mean, it is very expensive. It's a very, it's a tough market to work in. So making those preparations, or as she even mentioned, there are vehicles like life insurance products where you can pay an extra amount monthly to put a rider that will pay some benefit for that. The biggest mistake people make, Darcy, is they wait till they're 65 or 70 years old. And just like life insurance, if you buy life insurance at 50, it's a heck of a lot cheaper than at 75. So having those conversations now, working with your agent, talking about things you can do to prepare for that time, because that time will come. I forgot the quote they used, but I was fascinated by it, where somebody said, remind me who said it, they said, either you will be a caregiver or you'll be...
First Lady Rosalind Carter.
Rosalind Carter, right, may she rest in peace. You either be a caregiver, you'll be receiving care, you're going to be a caregiver, or you're going to be receiving care. There are 4 types of people, so be prepared.
Yeah. Tanya, let's talk about this. We know that our population is aging. We know we have more of a multilingual population as well. Can we talk about the difficulties that existed in trying to navigate that with your parents who spoke very good English, but it was not their native language?
Yes, Mom spoke 5 different languages. Spanish was her first, and she went back to just speaking Spanish. So at that point in time, which was, we're talking about 7, 8 years ago, we couldn't find that one person that could speak both languages. So it was just a non-starter. Macy helped me through that process, and we wound up just kind of changing everything. And then I became this proponent within the nonprofit of showing, well, we need more interpreters, even if it's just to accompany on a doctor's appointment, if it's to accompany to, long-term memory care, whatever it is, we need an interpreter. Lisa's Care Connections, they were welcoming with that idea. So that's how we managed it. And then we continue to help our neighbors, if you will, with that lingual, it was like a vast ocean, but we helped them maneuver it because there weren't anyone, there was not anyone, and I'm not sure that the field has grown too much right now to say that we have a varying number of health home providers that can come in that are bilingual by any stretch of the imagination. And when you have someone who is declining, because Lord knows dementia's a beast, you have to meet them where they are. You cannot you can't pull language out of them that they are no longer able to tap into. So you have to meet them where they are in order to give them the best care that you possibly can.
Darcy, I want to say something about this one here. So Tanya represents the sandwich generation caregiver. So that's the caregiver that's caring for their parents, also caring for their family member, but this one here also cares for her community, right? So she's like a triple-decker sandwich, right?
I'll take that.
And not really caring for herself, but that's what makes her very unique, because she has lived experience. And when you have a gap generation caregiver, so that's the caregiver, you know, I tend to relate to in terms of caring for someone who doesn't have enough resources to pay the $35 an hour for an in-home caregiver, but makes too much money to qualify for Medicaid, because in America you got to go broke to be able to afford long-term care. So what she's done is she has created space. She has created resources that really connect to a very vulnerable population when it comes to caregiving. When we talk about Alzheimer's and dementia, Black people are 2 times more likely to develop Alzheimer's in their comparable groups, but Hispanics are 1.5 times more likely. And we're not diagnosed early enough when the medications are most effective. And so the work that you do, Tanya, in your community has been a game changer, and I am sure has saved lives. And so when you don't have the resources, create the resources. And I just had to give that plug, because that gap generation caregiver, we don't talk about them enough, you know, and they're the ones that don't get the support. You're a gap generation caregiver, and the profile of a caregiver is everybody in here tonight. There's no one particular person that looks a certain way that will become a caregiver. You can wake up in the morning and become a caregiver. And the question is, who do I call? Where do I go? As I speak across the country, I tell them all to reach out to their Department on Aging. Whatever name they go by, the Department on Aging is a great way to start.
One of the things that surprised me the most, and you may remember this conversation that we had towards the end of my mom's life, I was asking, where do we get this help? Where do we get this help? And I'll never forget, you said, she's got too much stuff. And I'm like, what do you mean? And well, she has a home, and she has cars, and she has a 401k. And I'm like, why does that mean she can't get help? Director Munn, why does that mean she can't get help? And when can we change that?
Well, if I had that crystal ball and I could make those change, that magic wand, because you're right, that is an issue, and it's one that we can't change at the Department on Aging. It's a nationwide problem, but it is difficult, and I think that's what's so frightening, is people get to that point where they feel like they have to lose everything before they can get any type of help.
And I'll say to that, I love Sarah Klingman. She works with me, I work with her. A certified elder attorney can help you plan for Medicaid. Unfortunately, I'm just going to speak the language as the language is given. Medicaid planning, preserving assets, spending down to be able to qualify for Medicaid. Medicaid still does a 5-year look back. So again, the planning that we talked about earlier, planning now. And I also have to plug the PACE programs, Program of All-Inclusive Care for the Elderly. That program also goes underutilized. And so a person can have Medicaid, both Medicaid and Medicare. They can also have Medicare. And so the PACE programs can help folks also with Medicaid planning. And we just really have to speak the plain language to the people that in order to be able to afford long-term care, you will probably have to qualify for Medicaid.
Darcy, I want to take that conversation on a more macro basis too, because Dr. Smith brings up a great point. Think about all the people that are moving to South Carolina. Right? We were the #1 drop-off state for U-Haul rentals. Okay, people bringing U-Hauls from another state and dropping them off here, right? You know, Horry County, and there are senior communities popping up everywhere. But Macy mentioned Medicaid. Here's the challenge, though, is that some of these people live here and they move here and they will have a lot of assets, okay? Many of them are, you know, were middle class, had solid careers working wherever they work. They don't have a big retirement, so they potentially could be on Medicaid here, and it gets back to a point I made earlier. You can't just snap your fingers and create a bunch of Medicaid beds, right? You know, probably Medicaid, I imagine, is probably 90% of the nursing home beds in the state. And the cost to the Medicaid, I remember when I served in the Senate, this was really interesting. The Medicaid director at the time came in and said approximately 2/3 of the Medicaid, people on Medicaid in this state are children, and you know, what 70%, 75% are born into Medicaid today, but they're only about 1/3 of the costs. 1/3 of the Medicare members are seniors, and they're about 2/3 of the costs. And so, to the point you asked me earlier about the medical infrastructure, and you know, you were asking Director Munn about Medicaid, and you know, there's got to be a day of reckoning where that Medicaid budget is going to continue to have to go up to pay for these services for people that are no longer eligible, no longer can stay in their own home, don't have a long-term care policy, qualify for Medicaid due to some sort of spend down process, but they've got to have a place to go.
Yeah. We have a very educated panel, but we have a lot of folks in our audience that know a lot about this subject too. And so Beth is with the Alzheimer's Association. Beth, thank you so much for joining us this evening.
Absolutely. And I want to thank all of you. Both the documentary and this panel has been just, I think, an outstanding crash course for anyone who is new to caregiving or the landscape of aging in South Carolina. There's so much you don't know until you have to figure it out. And those who come into caregiving, it's often not a chosen role. It's something that happens to your family, and it's drinking from the fire hydrant. So thank you for this excellent resource. I want to take just a second to highlight some of the progress that we've made, because this can feel really heavy. And I think right now there's some really hopeful things happening. The South Carolina General Assembly has funded those dementia specialists in place across the state through the Department on Aging. That is a huge win. We're so excited about that. And when it comes to Alzheimer's diagnosis and treatment, we are now living in an era of treatment for Alzheimer's disease that we were not before. Just in the last few years, there are now FDA-approved antibody infusions available to treat Alzheimer's in the earliest stages. This is to give people more of those good days. And a lot of people don't know that's available. It's a huge reason not to wait to have those conversations with a family member, to have those conversations with your doctor. And with the healthcare system the way that it is, we know it takes time to get those appointments, to have those tests run, to get the results. And if you want to have that window of opportunity for these treatments, you got to start right away. So I encourage anyone who has concerns, go to alz.org. We've got the 10 warning signs. We've got how they're different from regular aging. And we've got tips for talking to your loved ones, as well as a wealth of education resources for caregivers, including a 24/7 helpline that people can call with any question on any topic in any language. So we encourage folks to check that out. It's 800-272-3900.
Thank you so much. Thank you. I think the overwhelming theme for all of us today is start today. Start today. It doesn't matter how old you are, start today. As we continue to look forward to the opportunity to age gracefully, what's the one thing that you tell people, and I'll start with you, Director Munn, I know this is a question for the entire panel. What's the one thing that you tell people and they immediately say, oh my goodness, I didn't know that? What is the thing that surprises them the most about your agency, about resources, about caregiving, about insurance? What's that aha moment when you speak to folks?
I think the aha moment for folks is that we are a small state agency, but we do so much. Wow. And the only reason we can do that is because of the infrastructure that's in place. With our area agencies and our service providers, we're a small staff, but we're mighty. And I think it's just that we reach, whether it's the long-term care ombudsman program, we have a vagal program, we have all the services that we can provide. And people are amazed at what all we do at the Department on Aging.
You don't have to do it by yourself, is what it sounds like you're saying.
Right, yes.
Dr. Smith?
Yeah, you know, one thing that I can speak on today is the new Medicare program that is funding some dementia care support, and that's the Medicare Guide program. Medicare is now covering approximately, I would say, about 72 hours of respite care. They're providing a care manager, they're providing education and training, and it is all now a Medicare benefit. And, you know, I tell folks all the time, you know, aging on purpose, you can't help that. Aging is a requirement, but getting old is a choice. Do what you love and love what it is that you do. And when people say you're not alone, you're not, but it is our responsibility, and the onus is on us to ensure that people have the resources at their fingertip. I know the Alzheimer's Association number by heart, not a problem at all. And so when they can get together and have those resources, they're understandable, and most importantly, they are transactional. I mean, we know the numbers. Now it's time to put the names to the numbers and action to that. And so when we can share that, then it gives family members hope. I didn't know that. So Medicare now is covering some form of dementia care. And there is treatment now. But knowing the early signs, and we ended up talking about Alzheimer's and dementia as we're talking about aging, that's because age is the #1 risk factor. But newsflash, it is not a normal part of aging. Just because you're getting older doesn't mean you're going to get it. There are more people over the age of 65 who don't have it than who do.
Wow, wow. Tanya?
All of that. But for me, respite, that I call it a mini grant, because in my world that's what it would be. But respite care, when I tell another person who is taking care of someone and I can see the exhaustion and I can hear the exhaustion, I say, do you know that there are programs for respite? And when I was introduced to senior resources, and they said, you know, we have this program and there is a wait, but we can do something. And I finally got someone to come to the house. I waited at that door like it was Christmas morning with Tylenol PM in one hand, a glass of water in the other, and I was just waiting. I was waiting for them to come through the door so that I could sleep. And when I give that description to someone, they're like, somebody will come to the house? And I'm like, yes, yes, girl. So let me give you all the numbers and all the context, and I'll stay on the phone with you as we make this call, because I'm telling you, it was one of the things that saved me mentally and physically, to know that someone could come to the house overnight, get paid for it, and just allow me a time to restore.
This has been so good.
That's one thing we preach to, you know, to our caregivers, is that if you're not taking care of yourself, you cannot take care of your loved ones. And that is so sad, because we see that so many times. You don't feel like you can take that break. But we have to keep educating, and that's one thing we educate. Take care of yourself.
Yeah, because you can't pour from an empty cup.
No, you cannot.
All right, we're going to have closing remarks. We're down to less than 4 minutes.
Sure, real quick. On the insurance side, and I appreciate you mentioning Senior Resources. I see Andrew Boozer here. They do such a great job, and we have these types of organizations throughout South Carolina, and they also, in addition to Meals on Wheels and that, they operate the Lurie Center, which was named for my late father, which is a great facility here in the Midlands. On the insurance side, here's what I'll tell people right now, because this happens every day in our office. A spouse will call in and say, my husband has dementia, or my husband's ill, can I come in and change his Medicare plan? A child will come in, child my age, and say, hey, I need to look at my mom's Medicare plan. Legally, you cannot do that without a medical power of attorney. So if you take anything that I've said tonight, go ahead and get a medical power of attorney with you and your spouse and your parents, so that in the event when that day comes where they are not capable of making those decisions, you've got the legal authority to do so. Because a compliant agent will not do that without knowing that they're dealing with a medical power of attorney.
Awesome. And 30 seconds, last final thoughts. Whoever wants to go first.
There's resources, ask questions, and receive the help when you need it.
And I'll say, your parent actually doesn't need a parent. They need a partner. Partner in their care to help both of you age on purpose.
Just look at it as aging with dignity and grace.
Well, ladies and gentlemen, thank you so much for joining us this evening. To our live studio audience, thank you so much, and thank you for joining us. We hope today you walk away with more information, feeling empowered, and knowing that you don't have to parent your parent. You can be your parent's partner. Oh, look, it looks like we still have a minute left. Oh, wow. That never happens in TV. We have more time to talk. That gives us time to give the phone number one more time for the Department of Aging. That number is 1-800-868-9095. Again, 1-800-868-9095. And as always, you can go to their website, getcaresc.com. Dr. Smith, your website?
It is drmacysmith.com. That's MACIE.
And Tanya, your website?
LimitlessCDC.org.
And Joel, your website?
GloryLifeandHealth.com.
All right. I hope everybody got all those websites. But if nothing else, you can always reach out to the Department of Aging and you will find a friend there who will be able to help you along the way. So we are wishing you the best of luck as you take this very important information and use it in your life and with your parents. Have a great evening.